Hi, I'm Christine Nielsen, Chief Executive Officer for the Canadian Society for Medical Laboratory Science. I'm also a medical lab technologist. It's important to have great communication skills in healthcare. It's been well documented that up to 50% of errors that happen to a patient happen because of poor communication. And that can be everything from misinterpretation of results, it can be inpatient handoff, it can especially happen between transfer of patients between facilities or between the community. So it's really important for medical laboratory scientists to know that their communication skills have to be superior for us to do our job to the best of our abilities. It's so important, in fact, it's been in the CSMLS competency profiles for over 20 years. Since we moved to competency-based testing, it's one of those important skills, just like technical skills, that are really important for medical technologists to be sure that when they enter practice, that they are using those skills every day. Communication skills are really important for students. I think because one of the things that people really undervalue is the day we all go for our first job, everyone's equally qualified. It's your job during that job interview to make sure that you stand out. And you can stand out by making sure that you talk clearly, effectively, and with commitment to make sure that somebody understands you are the best qualified person for the job. Lots of errors can happen in a healthcare facility, misunderstandings can happen with colleagues, and you may not be clear with the people you report to or for being the patients. So enhanced communication skills are absolutely critical from the very first day you go to work. One of the most important things we can do as medical lab professionals is make sure that our message is heard with clarity on the other end. And that sometimes means that when we're producing a specimen that we know has had some sort of flaw in it, it's not perfect. So it's arrived at the lab, it may be hemolyzed, it may be a lipemic, it may be a short draw, but the result is still produced. A flag goes on the file, and we hope that a healthcare provider pays attention to all of the qualifiers about how to interpret that data. The reality is, in today's time-pressured world, data-rich environments, it's really important to make sure that your flag has been seen by the right person. Healthcare moves very quickly. Decisions are made as soon as lab results are released. So if it is important, critical, or can affect a patient's care, we need to take ownership for that. We need to make sure our message is heard loud and clear on the other end, and I know it takes time. But when you consider the impact of poor patient results or a flaw in patient data or interpretation, it could be really important on the other end. I always like to think, if I was the patient, what would I want done? One of the important roles for medical lab professionals is to become known as critical conduits of information. Canadians rely on lab tests every single day. Physicians, other healthcare providers require data and information that we produce. They also require some help in the interpretation. It's really important that medical lab technologists become known as great communicators so that we can make sure that we are conducting ourselves in the interest of patient safety every single day and not assuming that people know things about either lab information, lab systems, or lab testing. Another important aspect of medical lab science is when we produce data. One of the most important things that happens in any acute care facility is we have to make decisions every day based on scarce resources. There's not enough beds, there's not enough staff in some cases, there's not enough access to care. So it's really important that we know when patients are stabilized and ready to go home or are able to look after self-care or self-monitoring, and that's when transfers happen back to the community. It's also why we're so busy early in the morning at the lab, because we're busy trying to decide what are those critical values, who is ready to go home. One of the things that may not be understood either in a hospital system or an acute care system is there is a chronic shortage of beds. It's really important that we have people in the right units. It's really important that we have people getting the right level of care. Care is very costly, especially in places like ICUs and critical care units, so it's important that we know when it's time to transfer, and the lab is really important in that conversation. One of the other important things is the way that we communicate. So it can be having to do with timeliness, with the tone, with the assumptions we take in the communication we have. For example, medical lab technologists and medical lab scientists are experts in lab information, lab data, new and evolving tests, and when tests have become outdated. It's really important for us to see the people we work with as colleagues in the care of a patient. If we know of a better test, of a better system, or of a better methodology that can enhance patient outcomes or be more specific or more sensitive or more cost effective, it's really important for us to make sure that we notify the healthcare provider in a timely manner so different decisions can be made, always with respect.